I'm Brian Giordano, assistant professor with the Division of Sports Medicine, University of Rochester Medical Center, Department of Orthopedics. In general, people present to me with a wide variety of hip-type pathologies. They've often had pain for months, if not years. They've been given a variety of diagnoses, and often the diagnosis of hip-related disease and disorders is a challenging concept because there are so many different types of ailments that can affect the hip joint. In the last 10 to 15 years, one of the exciting features of hip-related disease is that there's some new, more minimally invasive treatments that are available to treat this wide spectrum of disease. The type of patients that we treat now span the gap from adolescents and even children in some cases to adult age, into middle age, and even more elderly populations. And with these more minimally invasive techniques, we're able to better identify the exact anatomic location of the problem and then treat it in a more effective way. Formerly these type of hip disorders were accessible only through a large incision with great amount of morbidity, pain, inpatient hospital stay, and a limited, more delayed recovery. The advent of arthroscopic techniques has kind of married both industry and physicians, in that as the concepts and the techniques to diagnose and address these disorders has improved, the industry has been the industrial component has been paired with physicians to offer new technologies to enable us to work in a more confined, tight space within the hip joint and repair structures that were considered unrepairable formerly, or required a larger open surgery in order to address these problems. And in the last 10 to 15 years, the indications for arthroscopic and endoscopic treatment around the hip have greatly expanded to being able to address not only disorders and problems within the hip joint itself, such as injury to the cartilage, with the example being femoroacetabular impingement or hip impingement, where there's abnormal contact between the bone surfaces, injuries to the acetabular labrum. Even early stage osteoarthritis is treatable through arthroscopic means. There's a variety of disorders outside of the hip joint that can be treated as well. Conditions of soft tissue snapping in the hip flexor tendon, the area around the outside of the hip with chronic trochanteric bursitis, tears in the different gluteal muscles, and now even procedures like hamstring tears can be treated endoscopically as well. For patients, there's a variety of benefits to undergoing arthroscopic treatment of their hip disorder. Number one, the procedure is performed on an outpatient basis through very small incisions. It doesn't require a formal large open incision or an inpatient hospital stay. Procedure is performed both under a general anesthetic and a regional nerve block to help control the pain response following the procedure for the first day or so. One of the most exciting features to me about arthroscopic treatment of the hip is that it's really on the forefront of modern sports medicine. It enables me to intervene in a way that's minimally invasive. For patients that are formerly very active, are very debilitated and frustrated with their level of function and their overall daily pain. And then being able to intervene in a way for them that allows them to return to their prior level of function, competition, and with overall improvement in their level of pain